Hi there, I'm Dr. Karen Leggett, the Women's Midlife Specialist, and today starts the first of 8 videos that will empower you with the knowledge you need to understand your risk factors for breast cancer. The title of this video series is Be a Superwoman Breast Cancer Brainiac. Over the next 4 weeks, you're going to receive 7 more videos on breast cancer. With each video, you will be smarter and more powerful with confidence and knowledge of what you can do to reduce your risk of breast cancer. But before we get started, the first thing I want to emphasize is that breast cancer is a very important and serious cancer. And it is also a very sensitive and emotional topic to many of us. Maybe because we are talking about our breasts and we think our breasts are part of what makes us feminine. Or maybe it is because breast cancer is the most common form of cancer in all women in the United States. Or maybe it is because most women know someone who has been affected by this disease. I don't know for sure, but I have noticed that sometimes a woman can get very sensitive and emotional when they talk about breast cancer. So I want you to know right up front, I'm going to do the very best I can for you in this video series without overburdening you with long, boring videos. I will try to keep the videos short and specific and the most important things on each topic. However, if I miss something, I do want to know what is on your mind. If you feel it is important, I will feel it is important as well. Of course, it's impossible to cover everything, but I don't want that to frustrate you. So I will be sending you a short questionnaire with only 1 to 2 questions after each video. It will help me help you. Please take just a minute or 2 to fill out these questionnaires. Also, every woman wants and needs to know what I will be sharing with you. So please pay it forward. Share these videos with all the women you know in your life, as well as the caring men who want to understand the needs of the women in their lives. So come on now, let's get started with some important statistics. It is estimated that among United States women, there will be almost 250,000 new cases of invasive breast cancer this year, as well as another 61,000 new cases of in situ breast cancer. In situ breast cancer is still localized, but it's still breast cancer and cannot be ignored. That is over 300,000 new cases of breast cancer this year in the United States alone. This represents about 124 women out of every 100,000 women. It is also estimated that there will be slightly over 40,000 breast cancer deaths in the United States this year. Yes, it is possible for men to get breast cancer. In fact, 2,600 men are expected to be diagnosed with it this year. It is rare, but possible. How about a little history now on breast cancer? In the 1980s, the incidence of breast cancer rose sharply. This increase was felt to be due to a rise in the number of women having mammograms. Breast cancer rates then leveled off in the 1990s, but then declined again in the early 2000s. Now, it just so happened that at the same time in the early 2000s, when new cases declined, the number of women having mammograms also declined, which means some cases were probably going undiagnosed. However, more interestingly, it was also during the early 2000s that the Women's Health Initiative study reported a suspected correlation of breast cancer with hormone replacement therapy in postmenopausal women. When this study came out, literally hundreds of thousands of women abandoned their hormone replacement therapy literally overnight. It is believed that the decline in new breast cancer diagnoses in the early 2000s is also related to the fact that hundreds of thousands of women stopped their hormone therapy at that time. Since 2004, the incidence of breast cancer has essentially remained the same. More good news is that the actual rates of death in the United States from breast cancer have decreased by 37% in the last 25 years. And this decline in death rates is felt to be related to improved breast cancer treatment and early detection. Now, when we look at race, the overall incidence of breast cancer is slightly higher among white women than black women. However, for women younger than 45, the incidence of breast cancer cases is higher among black women than white. In addition to this, actual death rates in African American women is 39% higher than in white women. Exact reasons for this is not known, but it's felt to be related to genetic differences in tumors, risk factors, barriers in healthcare, health habits, and behaviors. And the fact that breast cancer is generally more advanced at the time of diagnosis in black women compared to white. In Asian American, Native Hawaiian, and Pacific Islander populations, new cases of breast cancer as well as death rates are lower than non-Hispanic white women and African American women. Also, you can see that African American women have the highest breast cancer mortality overall, while Asian American and Pacific Islander women have the lowest rates of death. You can also see on this graph that Hispanic and Latino women are most similar to Asian women in having lower incidence of breast cancer and death rates compared to white and black Americans. So, there you have it. Some basic general statistics on breast cancer incidence and mortality. I know it was brief, but I think this gives you the basic understanding related to your particular race and ethnicity. And hopefully, I was able to share this with you without driving you too far into the dreaded tunnel of boredom. Now, here's what to expect in the next videos. Today we are doing part 1, introduction and schedule to Be a Superwoman Breast Cancer Brainiac. Part 2, genetic versus environmental influences of breast cancer. Just the facts, ma'am. Don't bore me. Part 3, tobacco and alcohol. A little indulgence. Is it okay? Part 4, muffin top out of control. What it means for you. Part 5, blood sugar and diabetes. How sweet is it? Part 6, the influence your diet has on your risk of breast cancer. You're going to be shocked. Part 7, hormones, what every woman needs to know. Part 8, environmental toxins, facts and fiction, and the power in between. So that's it for part 1, guys and gals. Make sure you send this video to every woman you know, as well as any man you think would like to help the women in his life be safer and smarter. Help spread the word. Share it on Facebook. And if you're watching this video because a friend sent it to you or because you found it on Facebook, be sure to sign up on my Facebook page so you don't miss any of the valuable videos in the series. Now, do me a favor. Scroll down to the bottom of the page. Let me know what you think. Give me a thumbs up. Let's do this together and make it the best 4-week-long series on breast cancer possible. See you soon.